In this clip, I will demonstrate you how to take blood pressure. Make sure you instruct your patient not to take any nicotine or caffeine prior, and make sure that he or she has rested for 5 minutes sitting down. Have the patient rest his or her arm on a surface at their heart level. Roll up the sleeve for better results. Then, make sure that the feet are planted on the floor and also that their back is well supported. Make sure you have the proper cuff for your patient. It has two lines. The first line indicates that if the cuff falls short, you may need a smaller cuff. And if it falls over, it indicates that you need a larger cuff. Therefore, when it closes, it should fall in between both lines. As you place the cuff, make sure it is tightly secured and align the artery mark with the brachial artery, which is on the pinky side of the arm. Now check for the pulse on the brachial artery and place a diaphragm with your index finger and your middle finger right on top of the brachial artery and beneath the cuff. As for the prongs, when you place them on, make sure that they are facing away from you. The next step is to get the valve and turn it all the way to the right in order to lock it. In order to release it, you just turn it to the left. You will then pump up the cuff up to 180 millimeters of mercury. You will then release the valve at a pace of 2 to 5 millimeters of mercury per second. You will then hear a set of thumping sounds. The first one that you will hear, that will be known as the systolic blood pressure. Then they will get softer, and the last thumping sound that you will listen to will be known as the diastolic blood pressure. These are known as the carotid cuff sounds. And these are the steps to take blood pressure measurements. Thank you. These are the different classifications for blood pressure, and the units are in millimeters of mercury. For normal, systolic blood pressure will be less than 120 and diastolic blood pressure less than 80. For prehypertension, systolic blood pressure will be 120 to 139 or diastolic blood pressure 80 to 89. Stage 1 hypertension, systolic blood pressure will be 140 to 159 or diastolic blood pressure 90 to 99. Stage 2 hypertension, for systolic blood pressure, it will be greater than or equal to 160 or diastolic blood pressure greater than or equal to 100.